Hi, my name is Dr. Nicoletta Frescos and I am excited to talk to you about the document that I was co-author on the Asia Pacific region for autolytic continuous debridement with a focus on biofilm management. The purpose was to provide expert guidance on autolytic continuous debridement with the focus on the biofilm management to improve wound care, and predominantly looking at the challenges in the Asia Pacific area, such as the temperatures, the resources, cultural differences, etc., but also patient-centred care with a focus on comfort and available types of resources, and in conjunction with that, looking at the different types of appropriate debridement techniques for that particular patient and their wound. With debridement, it removes the devitalised tissue. It helps with wound healing. The focus is basically on biofilm removal and also to prevent the reformation if we can, as much as possible. The other thing about debridement, besides assisting in wound healing and giving us better opportunity to allow the wound to heal, is that it gives us a better assessment of the actual wound bed, which then can guide us into what is the most appropriate technique, debridement technique and continuous debridement and wound dressings, etc., and take in consideration the patient and other aspects of care. The key considerations, well, basically a wound is complex, the patient is complex. We have the underlying etiologies and comorbidities that create even further challenges to trying to assist in wound healing. And when there are so many complexities, not only is it just you and the patient that you're dealing with to prepare the wound, it's important to also consider a multidisciplinary approach to it, because there are aspects that are required that's beyond just the wound bed preparation and your debridement techniques. You need to take into consideration the patient's pain, making sure that the debridement technique, whether it's a physical but also continuous autolytic debridement, is of comfort. The other aspect is the anatomical position of the wound, how we're going to approach continuous debridement, because some of that mechanical physical debridement is inappropriate, and it's probably a better way using autolytic debridement for continuously trying to clean the wound and reduce that biofilm disruption and removal. And as we know, biofilm can redevelop, reform within 12 to 24 hours. So we've got to just get there and attack it as much as possible. To do that, it's not just the physical or mechanical one-off debridement. It has to be continuous. And that continuous debridement is the opportunity to assist in the healing between the other physical and other types of debridement that you might want to use, other debridement techniques. So the autolytic continuous debridement is one of the perfect solutions for assisting in wound healing. Among the some of the dressings for autolytic debridement, a good example is the polyabsorbent fibre, which continuously cleanses and drags out the devitalised tissue. There is real-world evidence showing, highlighting that the polyabsorbent fibres, in addition to the antimicrobial, has improved wound healing and does a great job in wound bed preparation in terms of trying to eradicate the biofilm. It also adds and works synergistically with best practice standards, but if we cannot provide the best practice standards, we add it to other integral types of debridement techniques. So the other thing about the guidance is that it emphasises that debridement can be done weekly, daily, depending on the wound itself. But what I want to emphasise is, with your wound bed preparation, it's not just debriding at the time. Physical debridement needs to be continuous, but also, in particular for diabetic foot ulcers, we talk about debridement, it's mostly in your mind, we talk about mechanical debridement, sharp conservative debridement. But once you've done that, you still have to look at the wound bed itself. So you have to continuously be cleaning that wound bed. And so this autolytic continuous debridement is the perfect solution for just continuously trying to attack those biofilms from reforming. If you haven't looked at the document, I strongly recommend it, because not only does it give you options of different types of debridement, but also gives you the options of selecting appropriate dressings that will assist in your autolytic debridement. But also there's a pathway in there. So it takes in the holistic approach in wound care, wound management, but the clinical pathway starting from assessment, wound bed preparation, right through to selection and debridement techniques and other integral processes to get the better outcome for wound healing and patient, positive outcomes of healing.